All right, let's go there. There we go. Hello, everybody. Dr. Arafage here from Vet Triage. We're going to talk about mammary cancer in our dogs and cats. In continuing our trend here of talking about cancer cases, folks out there who have experience with this will realize a lot of this stuff is familiar, and those that want to know more about it can know about it. It's very common to see mammary gland tumors in dogs, more so than cats. And let's go over some basic fundamentals. Um, Breast cancer does occur in dogs and cats. They have a variable number of pairs of mammary glands, somewhere between 6 and 8, typically for dogs and cats. And just like human beings, it can turn into cancer. It's not always cancer. There could be other possibilities. For example, you could have, besides cancer, you can have benign growths, and you can have mastitis, which is inflammation of the mammary gland, usually as a result of lactation in bitches and queens. And then you could have um, um, any kind of like abscess formation independent of lactation, so basically infection of mammary glands as well. And that's pretty much it. There's not a lot of other options there for the most part for mammary gland disease. And mammary gland abscesses or infections, as well as mastitis, are not that common in dogs and cats. But they are differentials, they are possibilities. And it's more likely that if you're dealing with, especially middle age to older age dog or cat, either benign or cancerous growths are more commonly affected. The symptoms are straightforward. You feel growth, lumps, and bumps for the mammary glands. Sometimes they feel really hot and they're red. Sometimes they have open wounds, discharge from them, and you could have more than one gland affected at the same time. You can have a cancer in one gland and a benign growth in the other. It varies. So we do know that if you spay your females before their first heat, that'll reduce the risk of tumor development. That's been shown in an old school study, and probably needs to be revisited if it hasn't already. But every time your dog or cat goes through another estrus cycle or heat cycle, the risk of developing breast cancer goes up. So you typically want to spay them before their first cycle. So those of you who have read or heard or been told to wait for the first heat in your dog or cat, probably not a good idea from the standpoint of prevention of mammary gland cancer. You can have a tumor that starts off benign and then becomes malignant. So what you want to do is, the moment you find a growth, have your veterinarian examine the pet and see if it's something they can remove, or at least test to make sure. But it behooves us to remove benign growth surgically to prevent malignant transformation. So the chances of a benign growth turning into cancer increases as the tumor size increases, and it's another reason why you want to remove them early before they get too big. You can also have not just a benign growth here and a cancerous growth here. You can have multiple types of cancerous growths in the same patient as well that affect the mammary glands. So quite variable. So don't assume that a cancer in one gland is going to be the same cancer in others, and don't assume that a benign growth in one gland means the other growths are going to be benign. That's just not the way it works without testing them. The spread of cancer in dogs for breast cancer is less than 50%. In cats, it's well over 90%. It's much more aggressive with feline breast cancer, but and the chances of feline breast cancer being malignant is over 90%, whereas in dogs, it's like 50-50 chance of being benign versus malignant. So when you go to your veterinarian for this, number one, they're going to ask you if she's spayed, because most of the time when we see breast cancer in dogs and cats, they are not spayed. They're usually intact. And then what they'll do is they'll perform their complete physical examination and then consider testing the growth. So they'll stick a needle into the growth. It's called fine needle aspiration. They'll take those cells, place them on a slide, on a microscope slide, and that is cytology. And that cytology is evaluated either by your veterinarian or by a pathologist, depending on your veterinarian's comfort level. The idea is to figure out if it's benign or not. If it's benign, you can perform a surgery to remove just the growth or just that mammary gland. If it's cancerous, you may want to consider removing the entire chain, so all the mammary glands on that affected side. That's the importance of aspirating the growth. Then you want to make sure also, before you commit to any surgery or other therapy, that you have 3-view chest x-rays, so 3 views of the chest, radiographs, to make sure there's no spread of cancer to the lungs for screening purposes. And then finally, the regional lymph nodes. So if you feel that a lymph node is enlarged in proximity to the diseased mammary gland, then you want to test that as well. And that way you can see whether or not there is spread of cancer to that area. So let me see here. I have some notes I'm following. Bear with me here. Okay, good. Okay, so when you talk about surgery, you are trying to not just remove the growth itself, but you want to get some level of margins. What margins means is when you remove a tumor, you want to have a certain number of, usually measured in centimeters, of normal tissue on the outskirts of the growth. Now, the surgeon is going to guess that based on palpating the growth. And so they're going to say, okay, here are the growth margins. I want to get about 2 centimeters of margins of normal tissue beyond the tumor margins. And then from there, that's how aggressive I'm going to be with surgery. And the idea there is that based on studies, which can be quite limited, we know that a certain number of centimeters of margin is good for the chances of getting as much of a cure as possible. Oh, hi, Sarah Helms. Bitches and queens, Dr. Harafid. Yeah, that's the official terms. You're actually allowed to use them. For those who don't know, a bitch is an intact female dog and a queen is an intact female cat. For those who don't know those words. And then if you have a dog with multiple tumors, especially on one side, then you want to consider a complete mastectomy or a radical mastectomy. And that's removing the entire mammary gland chain from the thoracic gland to the inguinal and submitting that entire chain for biopsying. And that's it. And then, of course, you're going to want to spay them as well at the same time. You want to spay them because the influence of developing cancer is hormonally related from estrogen from the ovaries, so you want to spay them as well. Chemotherapy for these pets is not great, at least hasn't been shown to have any benefit from studies. So it surgery is the main modality here, and survivals really depend on what type of tumor it is. When in dogs, since the metastatic rate, the rate of spread is less than 50%, you're hoping for as close to a cure as possible, even with cancerous lesions. But then the next question is, well, what are the prognostic factors in dogs that influence whether or not this median survival time is going to be low, or there's a chance of having a malignancy? Well, there's a whole bunch of prognostic factors. Tumor size matters, where the larger tumors, like we said, are more likely to be cancerous. If there's ulceration of the skin, then they're more likely to be cancerous. If the lymph nodes have spread of cancer, then obviously you're dealing with cancer. If you submit the tumor for biopsy, which you should always do so, and it's a high histologic grade, then that worsens the prognosis. For those who don't know what a high histologic grade is, there are certain markers or attributes of the phenotype of the cells under a microscope when the biopsy is submitted that will characterize the tumor as being malignant or not. And if it is malignant, how malignant is it? There can be some that are low histologic grades, meaning they are less likely to be invasive and spread. And then there are high grades where they are very likely to be aggressive locally or spread to other parts of the body. Similarly, if you notice that on the biopsies that the cells are trying to invade the blood supply or the lymphatics, that's a sign of malignancy as well. If you have evidence on your microscopic slides from the biopsy that the cells are trying to replicate themselves actively, those are called proliferation indices, then that's also a concern for malignancy as well. If you test those biopsies for hormone receptor expression and they are negative for hormone receptor expression, that's also a higher chance of malignancy. So what that means is the hormone receptors are protein-based structures in the cell membranes of cells that hormones attach to in order to have their intracellular effects. So if they are lacking hormone receptors, let's say like estrogen or progesterone, then there's a higher chance of having a poor outcome with those cases. And then finally, sarcomas, which are a type of mammary gland cancer in dogs, have a worse prognosis typically than carcinomas. So that's how that goes. And then just briefly in cats, we kind of transitioned from both species to dogs. The symptoms are the same for cats. The testing is pretty much the same, although you could consider abdominal sonogram and or thoracic or abdominal CT or MRI with cats because of how aggressive those tumors can be. So you might want to be a bit more aggressive with the cat workups. Surgery is going to be the same recommendation for cats, and typically almost no matter what, you're going to remove the entire mammary gland chain in a cat who's affected by this because the chance of cancer is so high. There are some studies that show that chemotherapy might help, non-steroidal anti-inflammatories might help, but aggressive surgery is going to be the way to go. And if you're going to perform a bilateral mastectomy, either modified or radical, you typically want to stage it where you do one side first, then I usually wait 4 to 6 weeks and then do the other side. And the reason for that is because we want to make sure that the surgeon has enough skin available on that patient in order to close those wounds. Unlike the prognosis in dogs, which can be fairly good, cats, it's guarded to poor. Maybe you'll get a 1-year survival with cats, especially with follow-up with chemotherapy. The prognostic factors for cats is similar to dogs. If you have larger tumor sizes, especially those that are over 3 centimeters, they're more likely to be cancerous. If you see lymphatic invasion, if you see spread of cancer in the body or a higher grade of cancer, those also affect the prognosis for cats, meaning a worse prognosis. And then, of course, the increased proliferation markers or proliferation indices also are associated with a poor prognosis in cats. So, so that's a quick overview. Normally, this is a much longer discussion in a brick and mortar facility, but at least for our purposes here, I'll give you some insight in regards to canine and feline mammary gland tumors. As always, thank you those who are watching on the playback. Thank you for any questions that you guys have submitted to me, and for donations and all that good stuff. Subscribe and follow, all those good things, and we'll go from there. So, and Sarah Helms, thank you so much for that comment/question. We'll talk to you guys soon. Take care.